Hey guys, welcome back. It is, what's today? Monday. And happy Monday. I wanted to update you guys in regards to my thyroid visit today, or my endocrinologist appointment today. It was just kind of an update to figure out what's the next step. Please, this is a mess. It's just been one of those days where I've been been cleaning and catching up and running around, and lately I haven't really wanted to put makeup on, so or do much because I've been really tired. So anyway, but I wanted to give you guys an update in regards to my thyroid, which is so funny because this morning I looked at it and it looks like it's pretty healed, but like this glue looks like it's moving. It's so weird. So it's much darker, and I think it's just because it's dirty and it's gross, and I clean it, but you know, skin, whatever, gets in it or whatever. And so they told me to just let it be, and it should, you know, come off on its own or kind of want to peel off on its own. So I'm just going to let it be. Not that I'm going to have some little dangling thing off my neck, but I'm just gonna, you know, I'll just, you know, take it off if it comes off, and if not, I'll just let it hang, you know, do what it needs to do. And so, so went into my appointment today, as scheduled. It's been about 10 days. It's been 7, 8, 9, 10, yeah, 10 days since my surgery. And a couple of things that I've noticed that has happened since the removal of my thyroid. One, I can actually breathe much better. I can take in a full breath, I guess just a full breath of air, and just and feel like I've got air. But with that, like, I feel like I'm shortened of breath. Like I feel like I'm taking too much in, so I stop. I don't know if that makes sense at all, but that's kind of where that's at with when it comes to breathing. My voice, as I've said before, cracks a lot, so it comes in and out. I feel like I'm going through puberty. My voice is still raspy at times, so I'm not sure if that's just my vocal cords or the veins in my neck that the nodule is sitting on, or I'm sorry, not the veins, the nerve in my neck or my trachea that the nodule is sitting back on. If it's just kind of doing its healing thing and kind of getting to some kind of norm, I'm not sure. I don't know if I'm going to sound like this all the time or if I'm going to sound a little clearer. I don't know. I don't sing, so I don't know if my singing ability will get better. I play around a lot. That's just kind of what I do. But what I have noticed is it's still extremely sore. And I found out today a couple of extra things that the surgeon didn't tell me. And the reason why is he said that he was going to send everything over. I mean, he went over things with me, but then my endocrinologist kind of dug more into it and had a conversation with him and wanted him to kind of tell me what was going on. So he explained to me how much of the actual nodule, how much of the actual thyroid, sorry, was actually removed. So if you can picture a butterfly and measured at 3 inches. As I've said, mine has measured at 6 inches. So it's double the size, and that's what has given me the title or the label as thyroid disease, because it's abnormally large already, which shows some form of swelling on my neck. Not including having the goiter or the nodule growing, makes it even more or bigger, you know, swollen in the neck area. So just, you know, if you picture a butterfly and it's wrapped around a tree or wrapped around a tube or something, The 4 points in the back, obviously they can't see. When they do sonograms, they can't see what else is going on in the back around my thyroid. I did notice when they would do sonograms, not only did they just kind of stay here, but they would always go up in this area, down this area, and they would take pictures, but they never really said anything to me about it. So I don't know if they could see anything or not. So if you've got two, you've got your butterfly, your two wings on each side, they connect in the middle, obviously, which I've been saying has been pretty sore. Well, they actually ended up cutting more than half. So they ended up leaving they cut out the connector or connection. There's an actual terminology, I forgot what he called it. They cut this part out along with this entire side. So the only side that I have, or the only bit that I have, is on the left side here. And it's attached. It's not moving. It's not going anywhere. It's attached. And so they removed that entire side. In the finding of, with removing that, I think I've mentioned that there was a calcium pocket that they found to be enlarged, and he went ahead and removed that. That could have caused more issues for me in the future if he would have left it. And I have to give thanks to this physician, and I will send him a card and thanking him for him going in and doing what he did, because my endocrinologist was actually pretty worried. Those are things that they can't see. So those are the 4 points at the back of your throat that they can't see. And so he had asked me, because my numbers had always come out normal to their standings, and never understood why, if I was having certain feelings, why weren't they kind of matching to what my numbers were coming out of or from. So one of my calcium pockets was enlarged, and they removed it. And so with that, he had asked me if had I ever had any numbness around my mouth or numbness on my fingertips. He had asked some other questions in regards to calcium related, high calcium related feelings or symptoms, and I told him no, had nothing. And he said, okay, that's a good thing, but that means that it would happen in the future. And the time frame is obviously not something that they can specify on. He just said, and it could happen within the next few days, within the year, within a few weeks, within the next few years, within the next 6 or 7 years. You just don't know. It just depends on your thyroid and how much your thyroid could handle of all the things that are going on. So I assumed that was the end of the issues that were found. Unfortunately, they did find a tumor, but the tumor was benign. And they removed that. So they have decided to put me on thyroid medication because they're wanting to make sure that this side does not, they want to make sure that it's going to produce to compensate for this side, but they don't want it to overcompensate, because I still have nodules that are on this side that are not at risk, or that they feel that needs to be questioned or examined anymore. I mean, they did poke around while they were in there. So I can only imagine why they had my neck open. I mean, this is just for the amount of, because for them to go all the way back here and to notice certain things, I just can only imagine how wide this actually was stretched. But they ended up, like I said, leaving this side, and I do have nodules here, but they're very, very small. So the reason why they want to put me on medication is they don't want this side to overcompensate for this side, because once that happens, then these nodules will start to grow, and they don't want it to grow like this side did, if that makes any sense, meaning the nodules. They can't do anything about the size of my thyroid, but they're trying to work with the size of my nodules. So as we stand, I will be put on medication. I did get a script, and I also did blood work. So they wanted to make sure, or wanted to see what my thyroid was doing within the week, within 10 days of getting surgery, if it was working fine, if the numbers were still fine, if the numbers were off or not. But in the meantime, I have a script that I need to go get filled, which is on the very small dose of, I don't know if they would treat it towards hyper, if you have hyperthyroidism, because they don't want it to overwork itself. So maybe that's the case. And so he says it's a very small dose, and it's going to help regulate it. And then I will see him in a month to get more blood work done, and to see if my numbers had changed from the first blood work to the second blood work, and if so, is it negative or positive? You know, did it go up or down based off of the medication he has put me on? And then I will be a regular patient of his for every 6 months once we get everything done, because the worry of my thyroid growing those nodules is still there, but is not so high. And now that I don't have a full thyroid, I still need to be seen by him. So I wanted to give you guys that. It's a bit scary to know that these things came out after the fact, meaning after surgery. And am I grateful and thankful that nothing serious? Yes. But the idea of me actually having a tumor, the idea of me having an enlarged calcium pocket that they couldn't see, these two items they could not see, and they could only see the nodule that was growing out, but they could not see how large the actual nodule was growing, because not only was it growing out, like I said before, but it was growing in, and it was pushing against my trachea that was causing breathing issues. It was pushing against my vocal cords, which was causing the raspiness in my voice, of me feeling very tired or sounding like I'm very tired all the time. So I am thankful that the surgery, I'm very happy that we went forward to the surgery. Now the finances will come, we will pay as needed. I want to make sure that my physicians are paid for, because I don't want issues with them in regards to needing to see them in the future, but all other things, they will get paid for in due time. And you know, it's just a process, and it's very scary. It's very scary to even think or consider any of the things that they had found could happen or could be. So I guess the next steps are just to kind of follow with what the doctor was saying, and you know, I'm not here to fight him. I'm not here to fight anyone, actually. I'm just, and I'm not necessarily where I'm going with that, but I know that I can be stubborn about this, and allowing my emotions get the best of me. And you know, this is where I'm happy that I'm on anti-anxiety medication, because I don't know how I would be without it. I don't know if I would be able to manage very well. And so this has been a season in my life where God has most certainly stretched me and has challenged me in areas of my emotions, in areas of my faith. I know that without Him, I am no one, but I know that I can get through this with Him. So I hope that my journey through this can kind of help you or help someone through their journey of being diagnosed with thyroid disease and figuring this whole thyroid issue out and finally putting a name to it, a face to it, finally getting it taken care of, and now moving to healing and getting to a healthier me. You know, I've gone on YouTube and searched so many videos of the process of thyroidectomies and partials and fulls and everyone's opinions on it, and you know, it's scary. A lot of them are scary. A lot of them are, some of them are kind, some of them are very compassionate and are warming and helps me, and then some are not. It's the scary ones are the ones that have me freaking out and texting my husband and saying, oh my goodness, I'm going to gain 50 pounds with the surgery, you know, and that journey is still going. I have to say I did lose 1 pound. So I'm 1 pound away before my Ohio weight. So hey, I think I'm doing pretty good. But my goal is by the end of this year is to lose that other pound plus another 10 pounds. And so, but knowing that I can't do that, doing it the wrong way. I'm an emotional eater, and this has been emotional, this process. I've gone to the pantry for anything and everything. Yeah, it's been pretty sad. But like I said, you know, going through the videos on YouTube, it's scary, but I sincerely hope that someone sees this video and is just as scared as I am, and was as scared as I am, and is able to know that it's okay. You're going to get through this. Look at it this way. If cancer is what's in your future with your thyroid, it is the easiest cancer to get removed. But the idea of having cancer scares the boo-boo out of me. The idea of knowing that I had a tumor scares the boo-boo out of me. Does not matter if it's benign. Does not matter if it's removed. I had a tumor, y'all, and I didn't even know it. And there were a lot of things that were going on in my throat that I did not even know. And I'm happy that I got it all checked out. I am happy that I am able to get healthier. I am happy, and I look forward to getting healthier. So with that said, I will keep you guys updated. I'll let you know how these pills are going to make me feel, if they're going to make me feel a certain way. I'm supposed to take them in the morning time, 30 minutes before I eat. So I may just take them, you know, right when I wake up. I don't really eat until about 11 anyway, because of the intermittent fasting that I'm doing, that I'm working extremely hard to get back into routine because of being in the hospital and eating and sleeping during the day, and when I wake up I'm starving at night, so I'm eating at nighttime, and threw my entire eating habit straight out the window, and the things that I chose to eat straight out the window. Yeah, crazy. So I will keep you guys up to date with that, let you know if there's going to be any side effects, if I have any side effects, if it's going to affect the medication that I'm on for my thyroid or for my anxiety, and kind of just keep you guys in the loop with how this is healing, when this tape is, this hideous, dirty behind tape is going to finally come off. I've been driving, obviously, because I had to go to my doctor's appointment, so I'm able to look. It hurts still, but, you know, I can't just sit on my behind. You know, my husband's not here, you know, which I'm, again, thankful for him coming down and spending the time that he did here with me. But I need to get back into the groove of things and get back into doing what I need to do for my kids and for myself. So with that, thank you so much for being part of this process with me. Thank you for your kind words. Thank you for your, to my awesome friends and neighbors in this area. I didn't tell anyone in the neighborhood. I really didn't tell anyone, period, actually, about me going and having surgery. And it's not because I didn't want their help. It's just I didn't want them to feel obligated to have to help me. Now, granted, that could be left on to them, but I've been that person where I've said, hey, I'll be there to help. And then when someone has reached out to me and I can't because something happens, then I feel horrible that I'm not there to help. So I will do what I can by myself with my closest family, closest friends first, and then I'll let everyone know. So my neighbors, I've got a bouquet of flowers. I don't know if you guys, please follow me on Instagram. You'll see the flowers there. You'll see the candle there. It's a grand party of 5, but you may find it under grand party of because the 5 got cut off. But go to our Instagram page and you'll see the flowers. They're absolutely gorgeous. And you'll see the sweet candle that my neighbor across the street got me. My very first fall scented candle for the year. And it smells amazing. I could actually smell the candle all the way up here, upstairs, and it's burning downstairs. So, but yes, I am so grateful to have the people in my life that I do have, who has been extremely supportive, who has been lifting me up in prayer, who has been reaching out to me just to say, I hope you're doing okay. And I am. Believe it or not, I am. The tears may come, the shakes, the frustration, the worry may come, but ultimately I am. I'm okay. I'm okay. So, my friends, YouTubers, thank you so much for joining me, as I said before, on this journey. If you are a new subscriber, thank you for subscribing. Thank you for wanting to be part of this crazy family of mine, and being part of this channel. It's changing, it's growing, it's getting better as we go. I'm learning new things. I'm not techie. I don't do technology very well. Many people know that. Freaks me out to change my phone every year to get a new upgrade. Very easy, right? Go from a 7 to a 7, go to an 8. No, it freaks me out every single time I have to do an upgrade. So I just want you guys to know that I appreciate you guys hanging out with me and the dark videos at times, because the light is we are changing actually. A lot of those bright light, so that you guys can see me. And that's what I'm doing. This room is not very dark. So if you are a returning subscriber, thanks for coming back. Thanks for being loyal. Thanks for being awesome. And I am just